Good afternoon, members and friends of the MAP. My name is Richard Arboleda, the COO of the Eon Group. As some of you may know, Eon has run and published many researches through the years, foremost of which is the Philippine Trust Index, a nationwide survey that we conduct every 2 years to determine trust levels of key institutions. These researches have served as baselines for communications campaigns that Eon has mounted through the years. Last year, we entered into a partnership with a mobile research company named Tangere. This has allowed us to conduct surveys and researches at a fraction of time and cost versus traditional surveys. With the rollout of the Philippine vaccination program for our first priority group, our frontline health workers, commencing earlier this month, COVID-19 conversations shifted to discussions on vaccines and the issues surrounding them. For this survey, we were able to get 4,400 adult Filipinos who completely answered the questionnaire. Majority of the respondents hailed from Luzon, with most from the area residing in NCR, regions 4A and 4B, which are known epicenters, of course, of infections. Most of the respondents in this survey are young, with 78% age 18 to 35, 20% age 36 to 50, and only a little over 2% over 50 years old. Female respondents outnumbered the males in this survey, 57% to 41, with LGBT respondents making up 2%. Close to 2/3 of the sample belong to small households. Only a little over a third have children. The survey respondents are largely from the lower middle class and low income class, with a monthly average household income between 10,000 to 50,000 pesos. Only 3% of those surveyed have a monthly household income exceeding 50,000 pesos. Allow me now to share with you some of the findings that we gathered. First point, the path really is littered with fear of the unknown, residual trauma from previous vaccine controversy stories, both fact-based and fake news, that have been told and retold countless times across social media platforms and chat groups. Add to that the fatalism of Filipinos in a governance infrastructure that greatly varies from town to town and city to city, and you're faced with an increased confusion on what's real and what's not about vaccines. Second point, a clear majority still remains unconvinced that it is safe, owing to concerns over side effects and discrepancies between the information that they trust and the information that they receive. Those in charge of implementing the vaccine rollout must recognize the needs and behaviors of all these stakeholders. Next slide. So who do we believe? Friends or facts? Trust in the COVID-19 vaccines, next slide please, presents a contradiction. The survey showed that Filipinos believe in the information coming from the Department of Health and doctors, and yet they will be more willing to be vaccinated if someone within their network gets vaccinated. While respondents engage in social media the most frequently, their trust is not on social media. Their trust is primarily on TV and the DOH when it comes to though respondents report gathering their COVID-19 information from a diverse range of information sources, they are unified in their belief that the information available from these sources is still insufficient. This attitude persists across multiple demographics. Roughly 3/4 of the respondents say they have insufficient information. They are looking for more information on the side effects of vaccines. And many others want to know of the length of effectiveness, as well as whether various conditions inhibit the ability of the vaccines to do their job. Skepticism over the government integrity and ability to roll out the vaccine program also exists, although in this particular survey, that percentage is small. Some gaps in information. Most respondents, sorry, please. Most respondents appear to appreciate the value of COVID-19 vaccines as a way out of the current pandemic and quarantine restrictions. However, there is a small cluster that seems to have the impression that vaccines are curative rather than preventive. They said that vaccines should be given to those who are already sick with COVID-19. This confusion among many should also be addressed in communications efforts. Next slide. Hesitancy against COVID-19 vaccination, unfortunately, is still twice as strong as willingness. This just corroborates what has already been broadly suggested by previous studies. It will require many steps and an extensive and effective communication campaign to change these negative sentiments, converting to acceptance of the vaccines across the country. Next slide. We tried to look into whether living with vulnerable persons in the household increases the willingness of household members to be vaccinated. It does not seem so. Whether the respondent lives with minors, with seniors, or both, the willingness percentages remains within a narrow band. Next slide. Although better than the national percentages, reluctance still surpasses the willingness to be vaccinated, even among the frontliner population and those who have previously experienced being vaccinated against other diseases. Next. Of the 36% who are willing to be vaccinated, the primary reasons given are number one, fear of catching the virus, number two, high cost of medical treatment, and number three, belief in its ability to protect. Next slide. On the flip side, those who are reluctant to be vaccinated cite the following as their top reasons. Number one, fear of side effects. Number two, not being convinced about the proof that the vaccines work. And number three, belief that the vaccines are not safe. Next. When asked what can convince them to get vaccinated, the respondents gave the following. Number one, if there are additional studies about the safety and side effects of vaccines. Number two, if someone they trust tells them that it's safe. And number three, if their doctors tell them that it's safe. On preference, brand discernment is high. Many of the respondents are familiar with the brands that have already been issued EUAs by the FDA at the time of the survey. Respondents are thorough in their assessment of vaccine brands and indicate that high familiarity is not directly correlated with high trust. China's Sinovac, for example, boasts a high awareness, but this is belied by how many Filipinos do not believe in the effectiveness of their vaccine. They also shared that their brand of choice was either the one with the highest efficacy or the safest, according to studies and news that they have read. The overriding reason for brand distrust revolves around side effects, efficacy, and country source of the vaccine. These are rooted in transparency of information or doubts about the efficacy. So some insights that we gleaned from this survey. First is that there's still residual trauma from previous vaccine controversies. It still looms large and definitely contributes to vaccine hesitancy challenges. Second, add to the challenge the fact that our sources of information stretch beyond our shores. So it's important for policymakers to actively monitor global developments as a barometer for potential issues or concerns that may be raised locally. And third, with the vaccination program likely to stretch to 2022, public health will definitely figure into campaign platforms next year. And even as early as now, we are seeing vaccination messaging being dependent on political leanings. This further amps the challenge for vaccine communicators. Some recommendations. First, we need to be able to ease vaccine anxiety through comprehensive information campaigns. Respondents have communicated clearly that various gaps in their understanding. Those who wish to promote vaccinations should see to it that all questions are answered across the most popular channels in a non-judgmental and engaging manner. This is not just a recommendation for policymakers, but also for leaders in companies and communities who wish to reduce vaccine hesitancy among their constituents. Now that infections are on the rise, it may actually be a good time to start increasing the push for vaccine acceptance. Second, ensure that institutions are meaningfully engaging Filipinos online. We all know already, Filipinos have acknowledged that they are overwhelmed with the vaccine information, especially on social media. Policymakers and vaccine spokespersons therefore need to reduce confusion and not add to it by ensuring aligned and cohesive messaging. It is also imperative to have active social listening to get a read on trending issues and fake news, to be able to more actively combat misinformation. And third, we need to develop and maximize an influencer network. Survey respondents, many Filipinos have already said they will likely get vaccinated if someone they know or trust gets vaccinated. Relatability plays a pivotal role in convincing the skeptical to be vaccinated. When the vaccines are rolled out to the general population, testimonials will be very important. Health workers who have been and will be vaccinated in the next few weeks should also be encouraged to take a more active role in communicating to reduce hesitancy.
And now may I call on our first resource person, the health social scientist and professor of the Department of Clinical Epidemiology and College of Medicine of University of the Philippines, Professor Nina Castillo Carandang. Professor Carandang.
Gandang hapon po. Thank you to the Management Association of the Philippines for their kind invitation to join you this afternoon. Thank you to Mr. Salvador also for accepting my suggestions for the revision of the program this afternoon. Thank you, Mr. Arboleda, for your presentation. So I'd like to have my opening statement as emphasizing the importance of immunization as a key component of primary health care. So we might be forgetting that immunization, not only for COVID, is good for us to protect our health. It is also our indisputable human right and one of the best health investments that money can buy. It's critical to the prevention and control of infectious outbreaks for COVID and for other diseases. And currently, immunization prevents 2 to 3 million deaths every year from tetanus, pertussis, flu, and measles. It's a global public good, especially now in the time of the pandemic. But vaccines by themselves don't save lives. It is the vaccinations which save lives. No? So we need to get the vaccines from inside the vial to inside people. So the information Mr. Arboleda has shared will also be useful insights. Let me just share with you that I've just been invited by a large multinational to help them with their vaccine education campaign among their employees. And it's getting the right information. And not only from communication experts or social scientists like me, but also from health experts. And that's why I also suggested to MAP that they should also invite a physician. And I'm glad to have here on the panel also Dr. Beverly Lorraine Ho. So there's a lot to be done, but vaccination saves lives, just as long as we agree actually to have the vaccination. I had my vaccination last week because I'm part of the Philippine General Hospital community. And the process was simple because we were pre-registered. I didn't have any side effects. I was fully functional. I traveled from Los Baños, where I live, to PGH to have the shot and went home. And so far, it's been okay. So please think about the lives that we can save, the economy we want to restart, and the people that we want to save. Salamat po.
Well, thank you, Professor Carandang, for the insights that you shared. And now we hear from our second speaker, the Managing Director of Golden Arts Development Corporation, or McDonald's Philippines, Ms. Maria Margarita Margot Torres.
So the private sector has been working closely with government. So in this case, for vaccines, I work closely with DOH. So you will hear from Doc Bev in a while. And our playbook is the same. It is really to um, have public uptake for the vaccine because our goal is really a healthy Pilipinas. I thought I'd also share with you a summary of different national and global surveys. So you have SWS conducted in September, Pulse in November. You also have WIN and the Gallup survey, which is global. If we look at, we cut across the top box, although they have different scales. Some are 3 point, some are 5 point scales. You'll see that the willingness is around that range. It's about 1/3. If you look at the top two boxes for the global surveys, 30 plus 34, 31 plus 37, that range of about 68% is within the global average, except that we are a bit lower than our neighboring Asian countries. Okay, but this taught us to look at the different vaccination mindsets, and you have to be mindful of this for your companies. That there will really be about 1/3 who are enthusiastic, ready to line up, and you have anywhere between 15 to 30% who are rejectors, and the fence sitters, which are the ones we'd like to convince first, are about 35 to 55%, and they're in a wait and see attitude. We put together communication pillars that I hope can also help you define your comm plans. They form the acronym TRUST. It starts with the T of transparency. And on a national level, this means the decision-making process behind procurement, behind all the logistics. R is reliability, and this is where the scientific findings and the medical expertise comes in. U is understanding, and it starts with getting people to understand that one, even with the vaccine, they have to continue the safety protocols, and two, the merits of a vaccine in general and of COVID vaccine in particular. We have an S for stigma, which I think you should also determine in each of your companies. But on a national level, there is, and we are really calling it out because it's important to address it in communications. For us, there is a stigma of Dengvaxia in a certain sector of society, as well as China-made vaccines. And finally, the last T is testimonial, and this testimonial is important because there's no better way to prove that the vaccine works when somebody, an influencer, or a friend or family member has already gotten it. So I'm happy to hear that Dr. Nina already got her vaccine. We developed a manifesto, and essentially it defines the kind of tone and the messages we want to be able to build that confidence. I'm not going to read it. I will just let you hear the radio ad, which summarizes it. We already have confirmed sponsors that have contributed for us to produce the campaign that we will launch nationally sometime May. So I'm very grateful for these sponsors. We also plan to partner with medical groups. So the Philippine Medical Association has agreed. The Philippine Society for Microbiology and Infectious Diseases has also agreed. And we will meet this week the Philippine Foundation for Vaccination. Why is this important? Because the brands like this cannot tell you to get a vaccine. They're not credible. But they will certainly support the message of ingat-angat tayong lahat. But when it comes to saying ingat-angat, bakuna lahat, it should really be a medical expert.
And we go now to our third resource person, the head of Health Promotion and Communication Service and Disease Prevention and Control Bureau of the Department of Health. Let's all welcome a familiar face in the news, Dr. Beverly Lorraine Ho. Dr. Ho.
Good afternoon po, Ms. Alma. Good afternoon, everyone. Thank you for having the DOH as part of today's panel. I probably will just build on many of the things that Doc Nina and Ms. Margot have mentioned a while ago, and just add on a little bit lang. So, what have we learned the past 3 or 4 months of working on COVID-19 vaccines advocacy, and how does it relate to a lot of our vaccine or even just health promotion advocacy in the past? First is that first and foremost, we rely on science, no? Science which is based on evidence, but which is also not um, an exact science to a certain extent, because it entails a lot of art, no? So perhaps the vaccine in the vial will entail an exact science, but the vaccination program that Doc Nina has been talking about, that process of deploying it, will entail some form of art as well, and a lot of practicality. That said, we are guided by science, and we rely on experts, local experts who represent institutions. No, and I think this is an important thing to highlight in this entire communication campaign. A lot of people raise their opinions, talk about it publicly, but I guess what we want to highlight is the fact that opinions are not always based on evidence, and we should rely on good evidence. And evidence would have, some would be high quality evidence and some would be low quality evidence. And so it's easy to quote one study that says this is what works, etc. But then in totality, if you look at it, it might actually be the opposite, no? So that's the first item. And so we based all our messages on evidence, on science, and on institutional positions rather than individual opinions. Second is the process. We have put in place, you would say, guards, or say checkpoints in our processes to make sure that we can trust the process and the process yields results, outputs, outcomes that will be fair, and not just fast, no? Fair outcomes. And that this would include having, say, independent experts who can say whatever they want without being beholden to any of the bureaucracy, diba? And that should actually help us be reassured that one, the vaccines that will be used are safe and effective. Second, that the actual deployment program does not look at who has more resources, and therefore they can get the vaccines earlier. No? So a lot of us are in the space of what we would call, say, privilege still. And we are often used to getting or being able to choose. But at this point in time, there are several factors in the pandemic that make it actually very difficult for us to get used to what we have been used to. Or second is that there are population subgroups who might actually need it earlier than we do. No? So this is the concept of public good, and that's why certain principles have to be followed. And we hope that we are continuously able to allow the public to appreciate in totality the need to trust the process, because there are people who are managing the process and looking at it from a level that's not on an individual or just an organizational level. And I guess finally, one of the key lessons will always be that the messenger could actually be the message, no? And with that, it is important that a lot of the people who are going to be advocating for it really know or are credible enough about what they're talking about. So as what Miss Margot has mentioned kanina, we have been engaging not just in-house DOH experts, but a lot also of external independent experts to talk about the various aspects of the vaccination program, but more importantly, even lay people who actually have the ability to influence others, no? Pero alam natin in our context and based on what data has been showing us, it's still largely medical practitioners who are the major influencers in the country. So I guess I'll just end with that for now.
The insights coming from the non-governmental civil society sector will be shared by our fourth resource person, the project lead of A Dose of Hope. Let us hear from Ms. Josephine, we know her as Jopin Romero. So take it away, Jopin.
Hello, good afternoon, everybody. Good afternoon, Alma, and good afternoon to everybody here at MAP. Thank you to MAP for inviting me here. It's a pleasure to be able to interact with this really excellent resource speakers that you've chosen this afternoon. I'm also very happy to see the survey that Ion has conducted. It's quite optimistic, especially since I came from a Friday session of a province in the Visayas where the willingness of the people to be vaccinated was at a low of 20%, 21%. So I was aghast at the mayors, in fact, and the governor of that province. I will not mention the place, but they were also very worried because in that area, their constituents were only willing to be vaccinated at, about 1/5 of their constituents were able to do that, were willing to do that. So, and also the survey that you did, Miss Alma, as at the beginning of this session, almost everybody wanted to be vaccinated. Not sure if that's because of recent events where every day we've been having 7,000 or more cases. So everybody wants to be able to get past that. But such events are helpful in scaring people and in dispelling some of the fears that were mentioned by our earlier resource speakers. Now, I will take up the private sector and foundation perspective of the vaccine. A dose of hope is you can call it a movement that was started in October of 2020, when the opportunity for private sector and non-government people to acquire vaccines was made available to us. It was said, and I agree with this, that vaccines and protecting the people is a public obligation. So why is it that the private sector and non-government entities are purchasing or acquiring vaccines? Well, we see it as an opportunity to contribute to the vaccine pool of the country. And we felt that at the time, especially in the fourth quarter of 2020, when even around the world, the regulatory approvals for the vaccines were not yet released, there was too much uncertainty, and yet other countries were already purchasing in advance, reserving their own vaccines. And we thought that there may be some foundations and private entities in the country who would like to risk a little of their resources to jumpstart the investment of the country in these vaccines. And so that's what happened. On November 27 of 2020, around 2.6 million vaccines were purchased by private sector, of which half were promised to be donated to government for the frontliners and priorities of government, and then half to be donated to economic frontliners. And then it went on in January, more vaccines were purchased for a total of 17 million of that particular brand, AstraZeneca. And then since that time, we've helped to communicate new information about newer vaccines that have been approved or are about to be approved in the country, and will soon be made available to both government and private sector. So all in all, A Dose of Hope has helped to facilitate private enterprises to donate and to acquire for their essential workers and economic frontliners at least 4 brands of these vaccines. Now, even as the private sector employers are buying these vaccines for their people, they know that not many of their employees are interested or still have hesitation in taking the vaccines. So especially in November, when no FDA EUA was issued at all regarding these vaccines, the employers were only buying at 30% to 35% of their population or their employment. Come January and then now, we are seeing that there are more employees that are interested, and in fact are now asking if they could purchase vaccines for their families and households. So that's a good development. Nonetheless, there is still a big gap in information that our employees or economic frontliners have about these vaccines. There's a huge misconception and also a huge distrust in the information that is available. So we see this, we see many reasons for this, and one of which is, of course, the novelty of the virus. It's so new that we know that even as we, as countries implement the mass vaccination, there is no conclusive information as to how many times you will need to be vaccinated over the coming years, and how effective, how long the effectivity of these vaccines will be. So fear that they will still be part of an experiment, part of an imperfect vaccine, is also inhibiting them from saying yes, from being willing to be vaccinated. Now, this is worsened by factors such as distrust in traditional sources of health information, and the rapid and extensive misinformation spreading online. And then finally, of course, the fact that there is information that, or there is a misconception that the development of the vaccines was done very quickly. But this misinformation was clarified by our vaccine experts in last week's sessions, where Philippine vaccine experts reiterated that all of the vaccines that are available in the country, in fact, in the world today, have been under development for years, even decades. It is just that maybe the application is now being used for coronavirus or COVID-19, but the platforms being used have all been, are all trusted and verified. So to the point that was made by our earlier resource speakers on the brands, I think there is also need for us to speak more on the technology behind the vaccines rather than just the brands, and also the source or the country of origin of the vaccines. We found that in our 3 vaccine literacy events last week, where we had a total of maybe about 6,000 people attending, as the vaccine expert talked more about the technology behind the vaccines rather than the country of origin and the brand, as more facts and figures and more case studies are explained by the vaccine experts, the listeners, the employees, and those who are hesitating become more confident that there really has been more, a lot of thought and research put into these vaccines. So we continue, a dose of hope continues to facilitate access to vaccines, particularly now for the smaller enterprises. Among the initiatives that we are working on, besides actually providing them with information, is to look for financing entities that can help our smaller enterprises fund their vaccines. Also, we are helping LGUs to access vaccines through donations and through coordinating with national government and directly with the pharmaceutical companies. So hopefully with all of these efforts, we are able to contribute to the vaccine pool, or at least the plan of the country, depending on what you, on who you're talking to. The government has about 144 million to 170 million vaccines directed towards the Philippines, either by donation or actual purchases of government, just for 2021 alone. And I think with our communication experts here, that information also needs to be communicated properly or transmitted properly around the nation, so that people do not think that there will be a shortage, which of course adds to the uncertainty that people feel.
The Deng Vaxia controversy, and before that we had the MMR about autism and the relationship of measles vaccines to that. appears to have left a deep mark in the psyche of the Filipinos. So this is something that we probably would need to address so that we get those negative impressions out. And this is contributing to the reinforcing the hesitancy among our people. And also because fake news, factual, and political issues seems to have clouded all of the issues on vaccination. So question, how can we reverse these negative impressions that are reinforcing hesitancy among our people, and how can we restore trust in the vaccination process? So maybe we could start with Professor Dina, then we'll go through the rest. Thank you.
Please repeat, Ms. Alma, the question.
Oh, how can we reverse the negative impressions that are reinforcing the hesitancy among our people, and how can we restore trust in the vaccination process?
Well, it's a very muddled story, and Bev
Yeah,
knows
I
my
know.
views on this. And the muddling also came from government. Let's be honest. And it started with all of the secret immunizations of the different prominent people and those who have admitted and not admitted. So the fact that they muddled the story in the first place created a lot of distrust. That's one. Second is also the lack there. I was just messaging my colleagues now. We're attending to other things. I'm a member of the National Immunization Technical Advisory Group for COVID-19 vaccine, and we do have a lot of different issues, and Bev knows that because we've been exchanging messages 24/7, actually, Saturdays and Sundays, trying to sort out different details. So one is that storylines have not been fixed because people aren't admitting what they did. As a scientist, I'm actually interested to what happened to the health outcomes of those who got secretly vaccinated, because we want to monitor the side effects post-immunization. But they don't want to share the data with us, despite the FDA's request. Please share the outcomes of the people who were vaccinated. So I think that's one. There's so much secrecy. So I think the fact that there's a secret nobody wants to talk about, suddenly there are people who are claiming to represent this company or another company, that leaves a bad taste in the mouth. So I think the fact that there were secret immunizations done added confusion to the story, because it added to the feelings also of mistrust and the feelings of inequity. Bakit sila nabakunahan na? Bakit ako hindi? Anong meron sila na wala ako? So yun yung mga posibleng nangyari din. So you probably know this also. We actually made a plea that the scientists and the experts and designated officials should be the only ones talking about the vaccination program. Because in the past weeks also, some people in government and other sectors have also decided to say, kami marunong, nakagulo. So yun yung problema din. So we really asked that there should be designated people to talk about the vaccines. And Dr. Ho has said that she relies, and her colleagues also rely so much on the different experts. So since January, I don't know, Bev, how many webinars we've had? Parang sa loob ng isang linggo, 2, 3 times. Buti nga si Bev, nakakapag-record lang ng kanyang message eh. Ako live, no? So can you imagine, week after week after week, pero natutuwa ako when you give more information and it comes from experts, scientists, doctors, it makes a big difference, which is what Mr. Romero said. So yun po, I think the messaging has been muddled because of the secrecy and the reluctance to share the real information as to what happened, and the different messages from people who aren't supposed to talk about it. Thank you po.
Thank you, Prof. Nina. We will now turn over the mic naman to Dr. Bev. So what can we say about this?
I think, ma'am, what you've learned is that there's actually no shortcut to getting information to people. It's not going ever to be a one-way street wherein we show a video and that's it, right? Or we give them social media cards, that's it, no? Parang the town halls that we've undertaken, kaya namin siya kailangan tiyaga-tiyagain po talaga isa-isa, and then we never say no to the invites also that come in. It's really because there needs to be a two-way dialogue. The people need to be able to ask their questions, even if their questions have been repeatedly answered already. I think there's value in actually the process, no? The intimacy of having them ask their questions and them getting their answers straight from the experts or the authorities who are actually deciding on these things. So on the side, like away from the public, we really have these town halls per sector, and the strategies are very, very different per subgroups po, no? So we also have been working a lot with the ILG and the health officers and the barangay information officers all the way to the ground. Because what we have learned from last year was that because also the nature of information, ang bilis, no? So we put it out, but then the people need to have someone to ask po sa baba, no? At their level or at the level of the community. And if the health workers in the community level are not prepared to answer them, then it can perpetuate not just a circle of misinformation, but also trust, di ba? Bakit hindi alam ng health worker ko on the ground yung sagot, no? Na sinasabi ng expert sa TV. So we made sure that the information is available until our barangay health workers, they've undergone their training for the first 2 months of the year. So mas ready na po sila, no? And they know they can rely on the local medical societies na. So PMA local chapters, for example, to be their resource persons when they do organize these barangay level, city level, municipal level town halls. So yun lang po yung sa amin, no? The massive information campaign will come in the next 2 months as we ramp up, as the supplies come in here. Di rin pwede kasing masyadong maaga yung drop ng mga campaigns natin, di ba? While the vaccines are still not here. But what we want to assure also the public is that in the background, this is happening, no? Yung kayod na group per group, organization per organization, barangay per barangay, it's happening, and because it really has to happen. Over.
Thank you, Dr. Bev and Jopin.
Hi. The information campaign is well and good, definitely needed, and we're doing that. Our experience is last week, Wednesday, Thursday, Friday, we had 1,200, 2,000 attendees in Bakit Bakuna sessions. And these are all workers. So, importante po yan. But this is another thing. Since I'll take up something that Dr. Karandang was saying, government needs to really clean up its act. This Deng Vaxia thing, you know what? A dose of hope, before it was a dose of hope, it was called Project Art because we were helping the testing. And we did not do this. Private sector and the foundations did not do this on our own. We are not scientists, so we asked for the help of many, many, many medical advisors. And we have been working closely with them. Some of them are with DOH, some of them are with the hospitals, and some of them are private. And many of them up to now are getting subpoenas and summons related to Deng Vaxia. So I mentioned at the start of my spiel earlier that in this province, that provincial webinar I attended, there's only 21% who are interested to be vaccinated. And that's because of the stigma. And the medical advisors who have been helping us previously do not want to help us at all in this vaccine because of the stigma against them. And also, they don't have the resources anymore. They said they cannot afford to lose more reputation than they already have. So that's something that government needs to look at. I mean, Doc Bev, we work together in T3, no? I mean, you know this anyway. So I'm being very candid about this. And as I think we've demonstrated, private sector and the non-government entities are very sincere in trying to find ways to help the whole country, the whole of nation effort. So yun lang po, if government can clean up its act, it will do a lot in improving the trust that people have on on the vaccination program.
How do we marry the intent of vaccinating as much of the population as possible to the unintended consequence of the recent DOLE advisory March 2021 that employees are not mandated to have vaccines? So can we weigh on, siguro let's start with Dr. Bev, and then we'll go to Prof. Nina and the rest of the group after.
I think the principle here, more than not asking people to get vaccinated, is still the concept of autonomy, which is part of the four main principles in medicine, diba? So beneficence and then autonomy. So people still are asked to decide for their own health. But syempre, that is predicated on the fact that they are well-informed. And when they are well-informed, they will actually make the right decision po. No? So I think the idea lang po of the DOLE circular is to make sure that efforts have been undertaken so that the employees are actually not coerced in any way to get the vaccination. So I think it's not contrary naman to what we really want to happen.
Prof. Nina?
Can I just go back to what Mr. Richard was saying earlier? That different experts had different opinions. If this were my usual webinar, as Ms. Margot and Bev know, I usually have a slide that we need to watch out for bias. We all have our different contexts and we all have our different bias. And that's a very important slide I always start all of my talks with. This is where I'm coming from. I'm a child of two prominent scientists and my late nanay was a national scientist. So yun yung dating ko. Doon ako galing. No? Anak ako ng siyensya, anak ako ng isang kalabaw at anak ako ng isang bulaklak. Because both have been named after my late parents who were scientists. No? So yun po, Mr. Richard, may kanya-kanya po tayong bias. And then another big problem which Bev and the team are always faced with is the infodemic. We don't only have the epidemic, we have a pandemic, we have an infodemic, which is much worse and which spreads much faster even than the virus. So how many fingers do we have? 10. And I just use a few of them to forward messages. Can you imagine how fast I can spread the virus, which is mistaken information, just by sending and pressing down on my phone or on my computer without leaving the house? So I have followed all of the minimum health protocols, but I can still spread the virus of the wrong information from my house because we don't have information hygiene. That is a challenge. So information hygiene and also the infodemic that we have are continuing challenges. So, Mr. Richard, don't expect everybody to sing with the same voice. That is not part of science. What we need to be able to do is to able to discern, okay, mas maganda, mas malinaw yung paliwanag nitong expert na ito. Versus, hindi ko masyadong naintindihan yon. So that's why I insisted kay Mr. Salvador that we should also have somebody from DOH and a physician on this panel. No? Kasi may mga clinical questions and for sure, at hindi ako magpapanggap na ako po ang sasagot noon. No? So we should also learn when to defer to another expert. No? So yun po din importante. Respeto din po sa kanya-kanya ding expertise, kanya-kanyang background at saka konteksto. Importante po yun because we're faced with the larger problem of the infodemic. Kanya-kanya ho tayong idea. And let me just read from what I wrote in July last year for a webinar which I did for the National Academy of Science and Technology. Policies for COVID-19 should be based on transdisciplinary and evidence-based science and good public health, sociocultural and behavioral realities, working together and communicating with each other are integral to a holistic response to the challenges of the pandemic. The so-called new normal is not normal. We need to pivot our responses, priorities, policies, interventions, actions, and behavior, which hopefully we can transition to what will be a better everyday in a just and humane society. I do not like the term new normal because that means we did not learn the painful lessons of the pandemic. We should aim higher for a better everyday where We have more of less poverty, more justice, less inequality, and better health for the Filipino people. So there are structural faults in our system. In the past year, our public health system has not yet been upgraded, despite the fact that we are in the middle of a pandemic. So when the surge hit again, we were just as equally unprepared, slightly more experience, slightly more learning, but not much better. So we also have to upgrade our public health infrastructure. We have very limited testing capacity. We have very few equipped labs. Our healthcare workers are tired. We lack healthcare workers who are willing to serve COVID wards. No? We don't even have our own vaccine production service. I remember as a child, I used to go with my tatay to Alabang, to the Serum and Vaccine Institute, because some of the staff in UPLB would be victims of snake bites. So pupunta kami doon ng tatay ko kasi kukuha siya ng anti-venom. And at the time, we were producing our own vaccines. And in the 1930s, we even sent vaccines to China. Tayo po ang nagbigay ng bakuna sa China noong 1930s. Pinabayaan po natin ang ating sarili nating capacity to make our own vaccines and to do good immunology and good vaccinology. So this is also a plea. It's not just about communication. It's also building the backbone of our health system, making sure that science and technology are given more of the attention it needs, because this pandemic is not just going to end with the vaccine. There will be another pandemic coming soon. And that is also our fearless prediction already. And we still haven't learned. So investments in science and technology and the education of our young people to be vaccinologists, immunologists. Let's have our own vaccine capacity also, so that we are independent on other countries, especially where there is vaccine nationalism and vaccine hoarding. We are so much the victim of other countries who have decided not to prioritize the needs of poor countries like the Philippines. Salamat.
Wow, thank you, Dr. Nina. Such wisdom. I'm not a doctor, obviously, and as your point about expertise, when it comes to communications, if there is something that I think we should understand, there is an adoption curve. So like for technology, hindi naman agad-agad lahat ng tao gustong kunin yung bagong technology, maaring bagong iPhone o bagong Android phone. Meron talagang early adopters, as they say. Yun yung 30% na willing. Tapos merong early majority, tas late majority. Kumbaga, susunod din sa uso yung iba.
Tinuturo ko po yan sa sociology, Ms. Marco.
Oh, so Dr.
That
Nina,
actually comes from sociology.
okay, so hindi ako sociologist, pero it looks like
Pero you're a communications expert. So that has been taken on in the communications field, and that has been very well studied po kunyari sa farmers. Yeah. Bakit yung ibang farmers early adopters of new breeds?
Yes.
Bakit yung iba ayaw? Bakit yung iba gusto ng mechanized thresher? Yung iba demano pa rin. Ganon din po talaga sa communication. And the vaccines are new. They're a new technology.
Exactly. And it's the same reaction. It's human behavior, right, Dr. Nina? So parang let's not get mad or frustrated that some people aren't ready to jump and line up. I think it will also really come in time. But in the end, they do realize if we constantly communicate, repeat the message that this is added protection, use the testimonials of those who have already taken the vaccine, and we will achieve the target that we are after, which is 50 to 70 million Filipinos vaccinated this year.
All right, thank you very much. But this is very interesting discussion, and sorry lang because we don't have a lot of time. So I have to ask for last words from our panelists, and we'll go back to the issue, which is actually addressing the vaccine hesitancy in the workforce. So maybe for your last word, you can give us your insight about your recommendations for business leaders. How can they help amplify the messages, and how should they speak to their own people, and what should they say? So let's do the round robin. Let's start with Jopin. Tahimik ka dyan eh. So Jopin?
No, because actually I agree with many of the things that they were saying. But there are more than 1 million registered enterprises in the country, and most of them are micro and small. So I'm a small enterprise myself, and with the wealth of information in DOH, which I regularly access, I still get confused. So we need to digest this information for our people. As business leaders, we need to help them understand this in their context and in their community, and in ways that will not intimidate them. It's not just like Dr. Nina was saying, it's not just communication, but it's also let's put ourselves in their shoes. When they hesitate about vaccines, they're not hesitating only for themselves, but for their entire family. What if they suddenly become debilitated and they will no longer be able to support their family because of this vaccine? Obviously, our vaccine experts will tell us that the kind of technology being used by the vaccines now will not lend to the same issues that we had before with autism or those scare stories that Alma mentioned earlier. But those are foremost in their mind. So what we do in the foundations, in the organizations that are trying to help the enterprises, is to go down to their communities. So we have sessions just for agriculture entrepreneurs. We have sessions for those that are in the Angat Lahat sa Digital. We also have sessions for those that are doing food processing and so on and so forth, so that we talk in their language. And then at the same time, we try to demystify also and explain to them what are the scary policies that are coming out in the news. Like over the weekend, so many people have been panicking because of the pronouncements of several legislators regarding the IRR that was mentioned earlier. Hindi naman po pwede naman pong i-explika, except that we need to really just break it down for them. So that's one. No? So that's what some of our business leaders can do. Also, maybe we know that the vaccines are an obligation. Giving us, protecting us is an obligation of government. But at the moment, ang dami po kasing bureaucratic inhibitors ng government, which is why private sector and the foundations initiated the what we did in the beginning of Oles Talk in November or Q4 of 2020. So we think that helped a lot. So if, as Margot is saying, the leaders, your icons, your role models will start and then take the risk, and then more people will follow. So follow the leader in the same way that they're saying na, oh, ayaw mong magpabakuna kasi takot ka na ikaw ang matatamaan. Oh, okay, so let me be the first to do that. But at the same time, let's make sure that we do not obligate them. There's the news in the US that no jab, no job. Pag hindi ka nagpabakuna, mawawalan ka ng trabaho or hindi ka nila interviewin. Awa ng Diyos, dito po sa Pilipinas, hindi tayo ganon. Here in the Philippines, we're more benevolent than that. And much as enterprises like me, employers like me will feel that the DOLE policy is going to be difficult for me, economically speaking, will we take it in our stride and look for ways to still assist our employees. So that's all for now. Thank you.
Thanks, Jopin. Dr. Bev, last words from you.
I think from our end, it's very clear that the government cannot do it alone. All help from all sectors are going to be needed to get this to happen. We traditionally vaccinate only 2 million kids a year. So that's really our practice. That's the best, I guess, scenario that we have done in terms of vaccination. Diba? And then this year, we're planning to vaccinate 50 to 70 million people. So it's something that we will all need to help each other out. The response may not be perfect, but rest assured that the people behind it are not only the people you see on television. There are a lot more people who toil in the background, and hopefully all of the efforts will redound to really a successful program, because that's what we all need to fully jumpstart the economy. So perhaps not just as a DOH official, but also as a fellow Filipino citizen, I appeal to everyone to continue to hold the government or your officials accountable, but at the same time recognize also that there's a perspective that's beyond our own, that other that agencies are taking a look at, because they have to balance your welfare with the welfare of the other people who actually cannot speak in forums like this. That would be all. Thank you.
Thank you, Dr. Bev. Well said. Richard?
Okay. So, for the leaders of organizations who are in this call, I think the first thing that I would tell you is first understand the vaccines. In your organizations, people look up to you and will likely look to you for information. So if you don't understand how vaccines work, how this whole vaccination process is being rolled out, you may unwittingly become a channel of misinformation. Sabi nga ni Dr. Nina, baka maka-contribute ka pa sa infodemic na nagaganap. And it's important that we really arm ourselves with the right knowledge from the right experts to be able to help more people within our own organizations understand the science behind the vaccines, the process behind how these vaccines were developed and how these will be rolled out, so that they in turn will be given the right information, and eventually that will help reduce hesitancy. As Doc Nina said, we all have our biases, and one way to be able to frame this properly is to really understand, the hesitancy drivers of the people in your organization. As Margot showed earlier, do a survey. It doesn't need to be super technical, but at least you have to be able to have a baseline to understand what your audiences in your organizations, what your stakeholders fear about the vaccine, so that you know how to be able to answer them. And if you can't answer, those fears because you are not an expert on vaccines, this brings me to the third point. Get experts to help you out. Whether it's a medical expert or a communications expert or even an administration and logistics expert to help you roll out, your vaccination program in your own organization. Do try to get them on board. If they're not inside your organization, get them from outside so that you can roll out your own programs flawlessly. Thank you very much.
Thank you, Richard. Prof. Nina?
Sa akin po is, katulad pa ng sabi po ng iba nating kasama, kailangan po natin pulsuhan ang ating mga sarili-sariling organisasyon. Napakaganda po ng analogy ng pagpupulso. Paano ba kinukuha ang pulso? Dito, di ba? Pero ang pagpupulso po sa organization, importante din po yan. Hindi ho tayo pwede maghawak kamay ngayon at bawal po, no? Pero maraming ibang paraan para mapulsuhan po natin ang mga kasama natin sa trabaho, sa pamilya. Look at your own spheres of influence. So tingnan po natin yan. Doesn't really have to be your office mates, your employees, your co-managers, your co-executives. We each have our own spheres of influence. Pulsuhan po natin muna yon. Tapos tingnan po natin kung ano yung mga agam-agam. Napakalalim po ng Tagalog, no? Let me lapse into the beautiful Tagalog. Ang mga agam-agam. So napulsuhan na po natin, kukunin po natin at raramdamin kung ano po ang mga agam-agam ng mga tao. Pagkatapos po nun, kukolektahin po natin yon, hahanapin natin ang paraan para matugunan ang mga agam-agam ng mga tao. No? Pag hindi natin kaya, tulad nga sabi ni Mr. Richard at saka ni Miss Margo, hanap tayo ng experts who will help us. So our usual town halls, the format usually is meron pong opening statement ang the hosting organization. Tapos po, one of my infectious disease colleagues will talk about immunology and vaccinology 101, very simplified version. Then I usually come in to talk about why it's important for us as a community, as a nation, as a company, as an organization to come together for vaccination. Then there is somebody from the Department of Health to talk about our National Vaccine Deployment Program. Then there is also a portion where you can ask already your questions and answers. So ano po yung mga madalas na tanong sa amin? Alam ni Doc Beb to, ang haba na ng kanyang bank ng mga questions. Ako po may mediabetes. Pwede ba ako magpabakuna? Ako po ay may hika. Pwede ba ako magpabakuna? Ako po ay may cancer. Ako po ay may kasama sa bahay na matanda. So very personal po ang mga tanong. So yun po yung pagpupulso, kukunin po natin yung mga agam-agam, hanapin po natin ang paraan para masagot natin po. No? And if all of the different town halls which Bev and I have done, even the one I did with Bev for McDonald's, nagbabago po after 2 hours ng pakikipagkwentuhan, balitaktakan, kulitan, kasi hindi naman namin ma-reach lahat, no? Pero yun, after 2 hours, so Miss Margot, if I remember, 88% po yung willingness, 12% yung not sure, at nawala na po yung no.
Yes, 0 ang unwilling.
So, ang akin pong laging pitch in all of those different talks is we still need to maintain apat dapat, especially now with the variants and the surge in cases. So physical distancing, face mask, face shield, open air, good ventilation. Pero kung apat dapat, meron din akong dinugsong po doon. Dapat tama. Kung tama, ligtas, mabisa, sulit sa presyo ang piniling bakuna ng pamahalaan. Kung dumaan naman sa tamang proseso, aprobado at rehistrado sa FDA, sumunod sa mga batas at tinakdang prioridad. Nasuri ng tama ang mga bakuna ng mga tunay at tamang eksperto sa kalusugan, pagbabakuna at epidemiolohiya, lubusang iginalang ang karapatan ng mamayang Pilipino sa kalusugan para sa lahat, dekalidad at tamang serbisyong pangkalusugan. And here is my punchline. Love kita, halina at magpabakuna. Ang bakuna laban sa COVID-19 ay hindi lang para sa iyo. Ang bakuna ay para rin sa proteksyon at kalusugan ng pamilya, kaibigan, katrabaho, komunidad mo at bansa natin. So hihikayatin po natin sila. Pinulsahan natin, tiningnan natin ang agam-agam nila, tinulungan natin sagutin ang mga agang-agam nila, yayakapin na po natin sila at sabihin, love kita, halina at magpabakuna. Salamat po.
Thank you, Prof. Nina. And finally, Margot.
Thanks, Alma.
Your
Thank you,
turn.
everybody.
Yes.
I just have 3 things. No? The first is, babalik ko kayo dun sa trust pillars. And I will emphasize the first 3 letters. One is transparency sa mga empleyado nyo kung paano kayo magdesisyon, ano bang nangyayari. R is reliability. Talagang kailangan natin ang scientific evidence at ang advice ng doktor. And U is understanding, not just the point of Richard to really understand where your employees are coming from, but to make them understand what the situation is and the importance of vaccines. My second point is I wanted to share this very powerful phrase of a philosopher. I don't know what I don't know. Socrates ho yata yan. Tama ba, Dr. Nina? I'm bringing that up because tandaan ninyo na hindi natin alam lahat. Hindi natin alam lahat ng detalye. So, kailangan magtanong sa eksperto at bago natin rin i-judge yung mga yung gobyerno, okay, o yung iba-ibang sektor ng society, tandaan natin hindi ho natin alam lahat. So again, I don't know what I don't know. Which brings me to my third point. Dahil hindi nga natin alam lahat, wag na tayong mag-contribute dun sa pag-spread ng fake news na hindi naman natin na-validate o na-verify. Tama ba ito? Kasi talagang ang sabi nga ni Dr. Nina, mas malala pa yung infodemic kesa dun sa pandemic. Ang bilis ng spread, hindi nakakatulong. But in the end, ako bilang Pilipino, napagod rin ho ako sa kakatanggap ng fake news, sa kakabasa ng mga rant sa social media. Kaya kahit may iba rin po akong trabaho, nag-volunteer rin po ako sa Task Force T3 para makatulong dahil sama-sama naman ho tayo dahil isa lang ang gusto natin. We want a healthy Philippines and we hope you can all help and contribute to make this happen. So magandang hapon po.